For this episode, we have public health professionals Jace Alacapa, MD and MBA specializing on health system strengthening, and Paul de los Trinos, health economist, public health researcher. But I want the intro to come from you. So, Jace, Paul, ano ang metaHealth?
Yeah, thank you, Johnny, for this opportunity to be given this platform, especially for metaHealth. So it's basically a consulting firm that helps empower our partners to reimagine quality and accessible healthcare toward improving lives in the Philippines. So basically, we start with our products, these information, transform them into insights, and hopefully these insights will help create an impact to pressing problems in the Philippine society. Yeah, I think that's a quick summary.
So yeah, I think metaHealth is very aligned to public health, and I want first to define. So ano ba ang public health?
Do we go technical or very basic? Let's go for basic. Yeah, we start from what probably most people would know, medical care, healthcare. So probably a lot of us interface with medical care pag nagkasakit tayo. So that is what we know. Now, beyond the realm of the hospital, clinics, we have this what we call as public health. There may be other terminologies such as population health, global health, but for the purposes of this conversation, let's just say public health refers to prevention of diseases, promoting health, treating diseases, and managing complication and disabilities. So it's basically an end-to-end care beyond the hospital. So it may involve what the DOH is doing, which is very timely now, especially in the time of COVID-19. Everything that we are dealing with COVID-19 has something to do with public health.
Yeah, actually.
I think that's it.
So, siguro something to add lang din, no? Public health is also about population level. Public health, hindi lang tayo concerned into like treating one person at a time, preventing one disease at a time. So, buong community tinitingnan natin. So, mga public health interventions.
Yeah, okay. So, let's start with the problem. So, ano ba yung current problem sa public health or sa healthcare system ng Pilipinas?
I think madaming problem, but I would like to zero in what metaHealth is trying to solve. So let me backtrack a bit. Now, how did metaHealth start? I think the story started sometime in 2017 when we were together in a coffee shop back in Sydney. Kasi kaming apat na founders, we all studied in Australia and we overlapped there. So we were having coffee and then we suddenly started talking about then recently passed universal healthcare law. The universal healthcare law, as the name suggests, it will attempt to deliver accessible quality healthcare for all Filipinos. And for us to be able to do it, there has to be a way of making sure that we allocate our limited resources. Okay. So, konti ang pera ng Pilipinas, but how do we efficiently allocate this? And one answer is what we call the health technology assessment, or HTA. A key component of HTA is economic evaluation. Basically, we just assess ano yung cost, ano yung benefits to determine which intervention will give more bang for the buck. Or sa Tagalog, ano yung mas sulit. Ano yung mas sulit na dapat pondohan ng PhilHealth. So this is how we started. So this is a problem that we have encountered, and we know for a fact that there are only a few people, if there are any, staying in the Philippines na kayang gumawa ng analysis na to. So that need triggered for us 4 people to found metaHealth.
If we're talking about the economic assessment nga and impact, so sino yung main makikinabang or gagamit ng service that you provide?
If your question is, if your definition of a main gagamit, we are targeting both the government and the private sector. The government, the DOH, we have the Health Technology Assessment Unit. The private sector, we have the different companies, firms, pharmaceutical firms. But ultimately, ang beneficiaries ay Filipino people.
Yeah, right,
because by doing these assessments, we will know ano yung sulit na gumagana at itong invest na ng government, hopefully free or limited yung out-of-pocket expenses ng mga Pilipino.
Kumbaga sa clients, hindi namin direct clients mismo yung mga Filipino na makikinabang in that. Pero yung mga stakeholders i-enable namin to actually participate in the health system.
Okay. Kumbaga in a business parlance, Johnny, it's a B2B, not a B2C.
Yeah. Kung okay lang, let's have COVID as an example. Like right now in the Philippines, taas ang number of cases. So first question, as public health professionals and as metaHealth, what do you think could have been done or we can still do to prevent the spread or to mitigate the effects?
Sige, actually, what could have been done with COVID? Nabanggit ko na ni Jace, meron tayong UH law, so Universal Healthcare Law. This is actually a great law that aims to provide access to quality healthcare to all Filipinos. So marami siyang components like improving coverage, improving the services. Kasi it was enacted in 2019. I think it was implemented siguro ahead of time. Siguro mas naging ready yung health system natin to address COVID. Kasi yung mga challenges natin sa COVID, no? Health information system, financial protection, health workforce natin. Yung mga yung kasi tinatry yung address ng UH law eh. So siguro isa yun sa mga pwedeng na-improve, no? Yung mga improvements ng UH law, if nagawa siya ng maayos or na-implement siya ng mas maaga, that would have helped.
Mm-hmm. Siguro, no, Johnny, just to quickly contextualize it, metaHealth and COVID-19. Ano kaya yung potentially na ginagawa ng metaHealth or magagawa ng metaHealth na sana ginawa sa COVID-19 to improve the current response? I think the direct answer to that is implementing cost-effective interventions.
Okay.
And by literature, yung cost-effective interventions ay vaccination, mass testing, tracing, treating. I think those things, alam naman natin, nagkulang tayo. If we are able to do it right now, kulang pa rin or mabagal yung ating rollout. If we have invested early on these things, probably we're in a lot better place right now.
Okay, so I get it. So like metaHealth is like a think tank nga to choose the best decision, to choose the best action basically.
Sakto. Kaya nga confidence in decision making yung aming value proposition.
Yeah. I actually saw that. And I also want to ask, so what do we mean by confidence in decision making?
Confidence is about rational decision making. So binibigyan natin ng lahat ng assessment, ng tools, ng dashboard, analytics, yung ating mga decision makers, be it on the public or private side, to make sure that they're confident sa decision na gagawin nila. But at the end of the day, we know decision making is political. So we just help them make their decision as rational as possible. But marami pa ring factors that may go beyond the inputs that we could give them.
Let's go muna sa approach ng metaHealth, which I saw nga is META, M-E-T-A. So first is management and implementation science. So how exactly?
Siguro, before we could go to kung paano marami tayong input, siguro we could discuss muna ano ba yung current gap sa management.
Okay.
So yung Pilipinas kasi we have the decentralized health system.
Okay.
So when we say decentralized, it's actually not the Department of Health who should be implementing the program. It's actually the local government units.
Okay.
Empowered ang mga local government units, ang mga local chief executives to implement programs with their health offices. Naging dulot yan ng local government code of 1991. So ang problema, so we have this decentralized system where there's limited capacity when it comes to management and also at the local government unit level. So that's why there's actually a lot of programs na they look good on paper, but they actually don't translate well or being implemented well in the ground. So Jace could actually have more experiences on that. He's actually specializing on implementation science.
Mm-hmm. Oh yeah, siguro just a big thought lang on implementation science. We're trying to address the knowledge do gap. So siguro researchers tayo lahat dito, we are all doing our doctoral level studies. We're familiar that for a publication and evidence to translate on the ground, it takes 17 years. Ganon katagal.
Yeah.
So implementation science aims to hasten this translation. And siguro since marami kang startup na audience, ang isang ginagawa na implementation is to establish the evidence to transition pilots to full scale up.
Yeah.
So it's not really a new field, I would say. It's a multidisciplinary field na kumbaga repackage. But it's very in kasi uso nga yung transition to scale sa mga startups. And even sa development world, for example, funders from Geneva, magpa-fund sila ng maliit na innovation. And you need to prove that you have evidence to transition it to scale. And implementation science answers that.
I also want to ask about yung sa decentralized healthcare system. So, ano ba yung role ng DOH in guiding the LGUs in their implementation?
So, ideally, ito sa local government code natin. Ideally, it's the local government units who are given the funds, who are given the resources, they actually want to implement the program, with the DOH providing technical guidance. So, mga national program ang DOH, and then yun ang susundin ng mga local government unit natin, ng mga province and ng mga cities and municipalities.
But meron bang chance na it becomes like bureaucratic? May chance ba na it could be better if like the LGUs can take responsibility, be ahead of what DOH is requiring?
We have experiences research that sa tropical diseases. No? Mga LGUs talaga na very ahead compared sa like, the Department of Health na may mga initiatives sila on their own. Halimbawa yung before the UHE law, like Guimaras province actually have their own health insurance program in the province. I think Jace also had experiences working with other LGUs.
No, yeah. Pwede naman sila maging ahead, but it's always within the confines of the national policy or guidance. Pag walang national policy or guidance, yan, there's a room for them to be innovative. But this would be largely dependent on our LCEs or yung tinatawag nating local chief executive. If magaling si mayor at yung counterpart niyang municipal health officer or city health officer or provincial health officer for the governors, malayo yung mararating. But siguro dyan, for our audience, para maintindihan nila, ang analogy ko dyan, DOH versus local government unit. DOH is like the brain and the spinal cord ng ating katawan. And then yung LGUs, yung kamay at paa. Yeah. But sometimes, may sariling autopilot din yung kamay at paa. As mentioned niya kanina, kung bibo yung ating local chief executives.
Especially like pandemic, kailangan talaga mabilis yung execution. So I think on those times, kailangan mabilis yung kamay at paa ng katawan.
Oo, very very evident yan, Johnny. Like for example, minsan ang bagal ni national government, ano nangyari? Yung mga LGUs, nagkanya-kanya, di ba? Nagkaroon ng sariling QR system, di ba? Iba-iba, may app,
testing,
mga tracking, di ba? Okay. Kaya, when the national government is overwhelmed during this COVID-19 situation, the LGUs are left to act on their own. Okay. And for those LGUs with high resources, for those LGUs with great local chief executives, gumagawa sila ng paraan. And we've seen this during this COVID-19 pandemic. Kaso ang ending, sari-sarili, hindi coordinated, nalilito din, di ba? So there are really two sides of the story parate.
Simple as yung QR code, no? Yung QR code lang na ginagamit sa tracking, no? Iba-iba yung mga LGU, sobrang...
What can metaHealth do for these LGUs? Meron bang insight or like innovation for those?
Well, currently, we don't have an active intervention for assisting LGUs. A lot of our technical assistance now are directed to national governments, DOH, WHO, and we had some clients na international development agencies. However, closest would be this COVID-19 pandemic. metaHealth has been a part of this consortium. This consortium is called Leads for Health Security. Leads, it stands for Leading Evidence-Based Actions through data science. So it's a consortium of public health and data science professionals that attempted to help in the earlier part of the COVID-19 response. So you can see we have a website, l4a.org or .com. It shows a dashboard wherein there are different cases in several LGUs. And this dashboard featured several values na kami, yung team collectively, ilan sa mga nauna na nagpakita ng mga ganong critical values to monitor, for example, community transmission. So itong mga to, very LGU-centric yung aming approach. But to date, wala kaming active intervention. But moving forward, definitely, we could help them with their analytics assessment, provide them with dashboard analytics, and decision support system. Again, to promote confidence in decision-making.
Okay. So yeah, it's the era nga of data, of big data. But question is, in the Philippines, are there challenges in data like data acquisition, data infrastructure, even data literacy? Kaya nahihinder yung paggamit ng data intelligence? And paano pumapasok yung data analytics na ino-offer ng metaHealth?
That's a very good question and very challenging problem to tackle. I think you as an industrial engineer, you will be familiar with this as you're a process expert, di ba? I think, let's just put it in the context of public health. One of the building blocks of public health is health information system.
Okay.
And health information system, a good health information system starts with data collection.
Okay.
Doon pa lang, bagsak na tayo. So bakit halimbawa, nagka-COVID ka, it will take weeks or even months bago ka ma-verify ng local government unit mo? It's because of poor data collection and poor data interoperability. In my case, I had COVID earlier this year. It took them 3 to 4 weeks after ako gumaling. Tsaka nila ako na-trace.
Okay.
Ang masama doon, nagkakalat ako ng sakit. I mean, di ba? Ako, syempre, doctor ako. I know how to keep myself isolated. But how about the others, di ba? Na hindi nila na-trace. So I think that's a very big problem. That's just the start, the tip of the iceberg. But as to your question on how metaHealth will be able to help here, well, for us, again, hypothetically, one of the services na ino-offer nga namin sa Meta Approach A is analytics and informatics. So we can help them sort this messy data toward, helping them gain insight. Again, through rational and confident decision making.
Do you think pala it's better or maganda ba na meron tayong centralized database? I mean, like for example, maybe connected sa national ID na andun yung health information ng bawat isang Filipino.
I would like to answer that on two fronts. First, I agree with you, and literature will agree, and I think Paul will agree as well, that it's important for us to have a unique identifying information. And to date, I think ang pinaka nagagamit ay PhilHealth, but not everyone is enrolled in PhilHealth kahit yun yung mandato ng UHC or Universal Healthcare. Now we have PhilSys, di ba? The Philippine National ID System. I think that would be a game changer, definitely. Kasi moving forward, at least in Australia and other countries as well, very strong in data linkage. So imagine you have a database A, you have a database B, database C, and you have this common data variable, your PhilSys ID, and you can link these databases. Now, second point na gusto kong i-bring up, it depends kung kaya talaga natin na magkaroon ng national data system or data clearinghouse. It's a complicated discussion. Some governments such as Australia, the UK, they have this national data clearinghouse. But sa US, they don't have it. What they do have are these what we call as regional interoperability organizations that attempts to do health information interoperability at a regional level. Ngayon sa Philippines kasi, ang mahirap dito, we are very fragmented, especially the healthcare sector. Public health sector, private sector lalo fragmented. The way we have developed our healthcare system is very much patterned to the US. And I think my opinion is that the way to go is the national government can have their national data system, but we cannot force the private sector to join. And within the private sector, I think there could be regional integration. Example, we have AC Health, Ayala Health. Of course, within their network, they could have interoperability. And we have another healthcare network. For example, we have the MVP group, the MPIC hospitals. They will have their own interoperability. And between these groups or silos, Ayala Health, Mani Pangilinan, MPIC, and perhaps the national government, there would be healthcare information exchange interoperability. Or sa language sa mga startup, imagine nyo, parang may API that will connect the two. I think that is more feasible rather than having a vertical top-down, bottom-up national data system.
Okay.
Just to set the background lang, no, kung ano ba yung current health information system natin. Kasi ayun nga, nabanggit ni Jace, so very fragmented siya. Private facilities natin usually not connected with what the government has. And then at the remote facilities, yung mga barangay health station natin, rural health unit, a lot of the data, public health data, are paper-based. So hindi talaga sila into any particular electronic system. So that's why when you need specific data sometimes, talaga hindi mo siya mahanap.
Okay, I have many questions. Let's go dun sa economics and outcomes research for health. This is about health insurance because you said nga we might be patterning our healthcare system like sa US. So I'm not sure if health insurance is working in the Philippines. Is it really working? Kasi like for example, in a really working health insurance system, kung nagkasakit ka, libre or very cheap. So my question is, how can we make it work? I mean, government health insurance as opposed to private?
So siguro I could give my thoughts muna, no? So regarding the insurance, napakagandang question yan. And actually, isa sa goal ng UHLO, no, na providing universal access to healthcare. Kung saan yung PhilHealth magkakaroon ng sobrang laking role.
Okay.
So sa Australia actually, when you get sick, hindi mo iisipin kung magkano ibabayaran mo kasi you are covered by the government. I think doon din sa Taiwan.
Yeah.
So Pilipinas is isa sa mga country na kahit gaano ka kayaman, pwede ka maghirap pag minalas ka sa sakit mo. So I know, for example, a friend who spent almost 4 million for COVID. So financially catastrophic yan.
Okay.
Kaya dyan papasok yung PhilHealth. And yung health insurance is very useful in our case kasi we have a mixture of private facilities and public facilities. So hindi pwedeng po tax-based. Kailangan natin ma-incorporate yung private. And we can do that through the health insurance system. So sa UHLO natin, ang aim talaga nun is ma-cover lahat. Tapos magiging parang dominant player ang PhilHealth. Siya yung makikipag-negotiate sa mga pharmaceutical companies, siya yung makikipag-negotiate sa mga facilities to dictate the price or to influence the price para mas maging efficient. And magiging mas affordable din sa mga Pinoy kasi wala silang babayaran. So yeah, I mean, health insurance is actually, I think, the way to actually achieve universal health coverage.
So, about sa T ng Meta, technology assessment, how can assessing technology or how can new technology maybe make healthcare cheaper?
Yan. So yung HTA, actually, Health Technology Assessment, that is one way, part of yung HTA, isa siya sa mga system to ensure efficiency. So
Okay.
Health Technology Assessment process siya on determining if an intervention is cost-effective, that's one. And also if they are ethical, if they are socially acceptable, or legally accepted, and other factors. So making sure na sulit and talagang optimal yung intervention. And in-introduce yan kasi gusto natin evidence-based decision-making, no? Evidence-based yung mga pinopondohan ng DOH and ng PhilHealth. Dati kasi nung wala pa yan, well actually hanggang ngayon kasi hindi pa naman fully implemented, parang kung sino yung ma-impluensya, siya yung nasusunod. So parang evidence-based decision-making.
Yeah.
Kaya very important yung HTA kasi sa UH law, pwede lang i-cover ng Department of Health or ng PhilHealth or bilang ng gobyerno isang health technology which could be a product or a service if there is a positive HTA recommendation. So that's actually one of the good development. Ang problem, again, capacity. And metaHealth is actually helping on that front as well. So we're actually currently conducting capacity building. So we're offering a course on evaluation health technology assessment in partnership with the University of Washington. So yung mga participants namin came from various backgrounds. So may from the industry, may from the government itself, and more from NGOs and other sectors.
Okay, so now let's go sa startup side ng metaHealth. So first question is, bakit startup? I mean, hindi ba siya pwedeng gawin from a government institution or from a large private corporation maybe? So why create a new startup?
Mm-hmm. As mentioned, we started with an underserved or unserved need. And this is this need to have this initially economic evaluation. And we have a national mandate. And there's a dire lack of human resources to do these things. Now, why startup? We started to deploy this as a startup because we wanted to maximize yung agility, yung flexibility, and yung ating collaboration. Kasi as you know, if you will be in the government or you will be in a non-profit arena, there would be, different nuances that we have to consider. Pero kapag startup environment ka, a private entity, you have these flexibilities. And this will allow us to be agile, to respond dun sa evolving needs ng ating bansa.
Yeah, exactly. Yeah. I think ang role nga ng startups is yung acceleration ng value creation. And like with a small private organization, we can be more agile in decision making.
Mm-hmm. Good point on value creation. I think another interesting point that I would like to highlight is that we are harnessing our first mover advantage.
Okay, yeah.
We claim we are the first HTA-focused firm in the Philippines. Meron kang national law to support. Marami ipapagawa si government, si private sector. Hanggang ngayon, kami pa rin nag-iisang HTA-focused firm. So imagine na lang the need that we are anticipating in the following years, especially mandated na. Bago i-fund ni government ang gamot, ang medical device, ang intervention, ang program, kailangan mo na HTA. So, kanina sila pupunta? Kay metaHealth.
Okay, wow. Okay, amazing. But are there like challenges and consequences of being a small organization?
Yes, definitely. Being a small organization, in so many ways, you can be limited as well, especially in terms of your absorptive capacity, because I have another NGO as well. Medyo mas mabilis yung pag-grow nun in the past 2 years. But what I'm trying to say is that commonly, kayong mga founders, kayo mismo yung nagtatrabaho, di ba? And you're very much familiar for startups, iba-iba ang setup eh. The usual startup founder story, bago fully mag-jump in yung mga founders, usually they still maintain their existing roles, their existing jobs. Then unti-unti, they try to take more time off until mag-jump sila fully dun sa startup. We're still at this stage, kaming apat na founders. And even your friend, managing director, we're having different roles. Wala pa sa amin nagpo-full-time. And we have this increasing projects as we move forward. So, syempre, nasa stretch din kami. So this is really one challenge that we have. And in the future, in the coming months as we grow, one challenge that we are anticipating beyond operational is maintaining our organizational culture. As we know, as you grow, di ba, natitreten siya. Kasi for young organization, culture is largely top-down. It is brought upon by the founders. Now, as we scale, as we have more people in the team, we have to maintain this culture to be able to develop the same quality and standards of our products.
So can I ask ano yung culture ng metaHealth?
Well, from the word itself, diba? We're an innovative startup. We are a very agile startup and very data-centric. But a quick look into our website will reveal our principles, which is largely influencing our culture. First is equitable access to quality healthcare. Second, leadership and excellence in data intelligence, insights, and innovation. Third is value creation through organizational effectiveness and efficiency. And lastly, empowering the private sector, because we believe achieving universal healthcare is not only solely a task for the public sector. It should be collaborative because the private sector has a lot to contribute and to help for the Filipino people.
So what does metaHealth envision in 5 to 10 years?
Yeah, this is a very interesting question. Now, for us, we actually envision metaHealth for 5-10 years to even go beyond the Philippines. But siguro ngayon, no, may some calibration kasi yung need pa lang sa Philippines, nahihirapan kami mag-scale. So siguro that 5 to 10 years, we will be strongly helping the government and the private sector toward doing these kinds of assessment, ultimately to help achieve Filipino people this universally accessible quality healthcare. Hopefully, 5 to 10 years, we may be able to expand in developing Asia Pacific.
Or maybe Southeast Asia.
Yeah, oo.
Yeah.
Karamihan din sa Southeast Asia, marami din yung mga health system in transition. So marami din sa mga Southeast Asian countries na nag-develop din ng universal healthcare, yung mga technology assessment.
Yeah. I'm thinking lang kasi hindi mainstream or like people, even me actually, I don't fully understand the benefits of public health and health technology assessment. So are you also looking at that?
Yes, it is important that everyone would know the benefits of public health and health technology assessment. But particularly, siguro, on our startup's perspective, it's important for us to highlight this need doon sa target customers namin. And as mentioned, we're a B2B platform. So the government, the private sector, that's why we're taking effort to do some advocacy activities. We're trying to do capacity building. We're trying to reach the pharmaceutical sector, the professional societies, because they know that this is a need or they don't know that this is an important need. So we help them unmask that need.
Yeah, exactly.
So I think that's our role here in metaHealth.
Highlight lang din, no? Yung public health is a very rich field. So there's actually a lot of opportunities. And I think that is something not realized by a lot of people. So when people think about health, they usually think about working as a doctor, working as a nurse. But there's actually a lot of things beyond that. So working in the health system, sanitation, and other things. Pwede na explore.
Kahit hindi nga health Paul Like Johnny, you're an industrial engineer. In my team, in the other NGO, Innovations for Community Health, sorry for cross-plugging, I do have industrial engineers there. They're working on my process quality and patient safety. And I really love their inputs. Because it's always about this multidisciplinary expertise that really enriches public health. So anyone can consider public health. You can bring your lens to help people.
Okay, that's amazing. Thank you so much, Jace and Paul.
Thank you very much, Johnny, featuring us in your podcast.
So thank you, Johnny, for this opportunity.
Thank you.